Hey guys, welcome to Cerebellum's PYQ 90-second series, and this is Dr. Dilip, and let us look at a case scenario. This is a kind of a case that you tend to get very commonly in INI-CET exams. You have a young 27-year-old lady presenting with acute blurred vision, which means there is a drop in visual acuity. And 3 weeks ago, she had sensory symptoms in the form of paresthesia in the left leg, which has resolved spontaneously. And you have to answer 3 questions here. Question number 1. What is the defect that is shown in the image? In the right eye, when it is shown with bright light, you can see a good and adequate pupillary constriction, but in the left eye, you can see that there is no good enough pupillary constriction after showing with bright light. In the context of the question, this is equivalent to RAPD, that is Relative Afferent Pupillary Defect. And in exams, whenever you think about RAPD, in the most common setting, you have to diagnose optic neuritis. So this lady is actually suffering from left optic neuritis, but that's not the diagnosis. Look at the second question. You have to find out the likely diagnosis. Remember, this lady is not only having acute optic neuritis, this lady also had a history of sensory symptoms in the past, which means there is a dissemination in space and there is a dissemination in time, which is equivalent to the diagnosis of MS, that is multiple sclerosis. And what is the next best test? You have to do a contrast MRI with gallium contrast of the brain and the spinal cord together. Thank you.